Maternal and Child Nutrition and Health Project is a resource-based financing approach jointly implemented by the National Nutrition Agency and the Ministry of Health and Social Welfare to strengthen community nutrition and food security. The implementation of the second phase came as a result of the successful piloting of the first round in the North Bank region west of the country. Beneficiary communities must be baby-friendly initiatives as one of the criteria for the project that is targeting 37 health facilities in about 700 communities across the country. NANA also signed contracts with communities, giving them subsidies on performance base. The contract looked at 10 indicators, and based on performance of those indicators, the communities are paid subsidies, 80% of which is taken for the development of the community, while the remaining 20% is shared among the VSGs, who are tasked with the responsibility of sensitizing the community on nutritional education and as well facilitate the referral to the major health centers. The strategy is that every community have a structure of 8 members comprising 5 female and 3 male who are trained on sanitation, nutrition education and exclusive breastfeeding, among other health issues. The VSGs, whose performance are closely monitored by NANA, also conduct training sessions with women as well as visit households to discuss sanitary and other environmental issues. In a bid to find out more about the project and how communities are implementing it at the local level, GRTS visited Kir Alaji Malik in Jokado in the North Bank region. The Village Development Committee chairperson, Jaye, explained how they were able to build the waiting room at the village health post and buy 2 million machines from the project. Hussein Ugai and Maria Manjai hailed NANA for a project that is not only educative but beneficial to their families and community. Hadiwada recalled how women used to deliver at home even without the help of traditional birth attendants. Thanks to the project, women are now aware of the risk and other complications associated with that. The village health worker Mam Kaur Job demonstrates some of the health measures taken by the villagers, including the local hand washing system called Tipi Tapa. From Kir Alaji Malik, the GRTS camera crew proceeded to Kuntaya Health Center. The officer in charge of the facility, Sambaba, said the maternal and child nutrition health resource project started 2 years ago. The communities, he said, has been one of the pilot sites implemented in the country. Ba said they have registered a lot of success from the project, and through the subsidies received, the hospital was able to start the construction of these staff quarters in order to provide accommodation for the staff posted in the health center.
We realized that the facility needs more nursing staffs, and if we need more nursing staff, we should also provide a space for them where they will definitely sleep. So this is one of the reasons why it has prompted both the RAT and also the staffs on the ground under my administration to come up with these big initiatives.
Ami Bob, community health nurse and midwife, harped on the improvement on people seeking behavioral change, adding skilled delivery at the facility and women who book for the first trimester, as well as men accompanying their wives and encourage them to deliver at the hospital, has increased remarkably compared to the previous years. She further stated that more children are now brought to the health facilities to receive their vitamin A supplications and mebendazole.
Skilled delivery that is delivering at the facility level, we have seen a great improvement, because before we were struggling to have 30-40 deliveries before the project. But as I am talking to the previous month, we recorded about 73 deliveries that are being brought from the facilities and they delivered here.
Ibrahim Jaye, a public health officer, noted the project has implemented a lot of programs, which has also brought a lot of improvement to the facility and community, adding the nutritional status of pregnant women and children under 5 has improved.
With regards to immunization, the project is definitely looking at the quality of the work we do in that site, and then staffs are definitely motivated and they're giving bonuses, and then that has caused us to strengthen our belts to make sure that there is no loophole and people are enjoying the best services that definitely deserve to have.
For Ajibanu Majalo, the resource-based project provides free services to the communities, thus encouraging mothers and their children to seek for medical care in a timely manner. From Kuntaya village, the GRTS group proceeded to Tubakolong in the Opanyomi district, where we found villagers cleaning the community health post. Anthony Balde said the project has changed a lot in the community, for the people are now aware of their own health status than before. He said the community of Tubakolong was able to secure this tricycle motor ambulance to ease transport services, especially for pregnant mothers and children. The VDC chairperson, Ajakadi Jaye, was happy to show Jaye as the milling machine that the community was able to secure from the project to ease the burden on the women who used to pound day and night with their bare hands in order to feed their families. The Regional Nutrition Field Officer, North Bank Region Alfambalo, gave an insight into the project and expressed his impression about the community-based project.
In the communities, we don't go and they'll tell the communities, identify your own bottlenecks or your own needs. But it's like the community themselves will sit and identify their own priorities. And then from the subsidy that they receive from the project, they use 80% of that money to implement those projects.
The Maternal and Child Nutrition and Health Resource Project seeks to promote healthcare service delivery and improve the nutritional status of the population, empower women and children, as well as improve the caring practice and participation of health workers. Mama Jaye, GRTS.